My name is Chowdhary, and I am currently a second-year physical medicine and rehabilitation resident at the University of Pittsburgh Medical Center. I have long-term research interests in translational sports medicine focused on the development of precision medicine therapeutics and technological solutions. I am profoundly thankful to the Foundation for PM&R for awarding our team the Scott F. Nadler Passor Musculoskeletal Research Grant in support of our project. I would like to start by introducing you to our team. First and foremost, I would like to thank my mentor, Dr. Fabrizia Ambrosio. She's an associate professor in the Department of Physical Medicine and Rehabilitation at UPMC and director of rehabilitation for UPMC International. Additionally, she is the founding director of the International Consortium for Regenerative Rehabilitation, the founding course director for the annual International Symposium on Regenerative Rehabilitation, and co-director of the NIH-funded Alliance for Regenerative Rehabilitation Research and Training. Her research has received numerous awards, including multiple Best Paper of the Year awards, and most recently she received the 2020 Carnegie Science Center Life Sciences Award. It goes without saying, I am very fortunate to start on my path to becoming a physician scientist under her guidance. I am grateful for Dr. Ambrosio's earnest dedication in helping me advance my career and teaching me the skills I need to be successful. Dr. Ambrosio is a mentor in a truest sense, and I am so thrilled to contribute this novel and innovative research to our field under her leadership. Next, please meet Dr. Amrita Sahu, my co-PI in this project. She is a postdoctoral fellow in Dr. Ambrosio's lab and has an impressive resume herself. As a doctoral student, she studied the role of an anti-aging protein, klotho, in the healthy aging of skeletal muscle, which ultimately culminated in a publication in Nature Communications in 2018. Recently, Dr. Sahu received the Delta Omega Dissertation Award by the National Honor Society of Public Health. Additionally, Dr. Sahu has received extensive training on extracellular vesicle research from the Don Gnocchi Foundation in Milan, Italy. Dr. Sahu's long-term goal is to develop targeted rehabilitation strategies for enhancing functional capacity in a geriatric population. Dr. Hirotaka Ijima is also a co-I on this project. He is a postdoctoral researcher in Dr. Ambrosio's lab and a visiting researcher at Kyoto and Keio universities in Japan, where he was awarded the Overseas Research Fellowship from the Japan Society for the Promotion of Science. The primary goals of his research are to develop effective and innovative rehabilitative therapies that promote tissue regeneration and maximize functional recovery for patients with musculoskeletal disease. Given his experiences as a physical therapist and his research focus in knee osteoarthritis, Dr. Ijima utilizes integrative approaches of regenerative rehabilitation to provide his unique perspective. He was recently recognized for the highest-rated research from young investigators in the International Conference for Osteoarthritis Research, Osteoarthritis Research Society International 2020. And finally, we would like to thank Dr. Alison Bean, an assistant professor in the Department of Physical Medicine and Rehabilitation at UPMC, for offering her expertise in the clinical application of orthobiologics and chondrocyte function. Working together with the stellar team, we are seeking to demystify the mechanism of action of platelet-rich plasma, or PRP. Since the ancient times, drinking or transfusing blood of young individuals has been thought to be a potent rejuvenation method that has been utilized widely in many cultures. In the modern times, Dr. Thomas Rando and others have utilized the heterochronic parabiosis model, where an old animal is surgically sutured to a young animal such that they develop a single shared circulatory system, which allows for the study of circulating factors contributing to the rejuvenation of the older animal. Preliminary findings from our lab suggest that young blood exerts potent anti-aging effects on aged musculoskeletal tissue homeostasis and function. Clinicians have leveraged this supposed fountain of youth through the use of PRP in the treatment of knee osteoarthritis, a highly prevalent chronic disease seen in the aging population. However, in the treatment of knee osteoarthritis, the patient's own blood is injected into their failing knee joint. So we sought to answer the question whether age attenuates the effects of PRP. And if so, would young PRP help old knees? We hypothesized that young but not old PRP would help restore cartilage structure and function. This leads us to another critical question. How does this happen? We propose that extracellular vesicles, or EVs, mediate the beneficial impact of PRP derived from young individuals on restoring impaired mitochondrial function in osteoarthritic chondrocytes. Through this research, a long-term goal is to design engineered EVs that can boost PRP preparation to restore a more youthful profile of an aging and functionally deteriorating chondrocyte. To accomplish these goals, we will be culturing chondrocytes with PRP and EVs of different ages and running our in vitro experiments at the McGowan Institute for Regenerative Medicine at the University of Pittsburgh. Additionally, we will be using cutting-edge imaging techniques that combine fluorescent imaging probes with flow cytometry, available at the Thomas E. Starzl Biomedical Science Towers, of course with all appropriate COVID precautions. Thank you again for your generous contribution and support of this project. We are excited to contribute this novel research to our field and look forward to presenting our results in the future.